Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is a webinar, as you know, where we're going to talk about Lyme disease. I look forward to seeing what questions you have for me tonight, because that determines what we're going to talk about. Although sometimes I go off on tangents, as many of you know. So there are a number of new people showing up here tonight, and I'm welcome here. I'm glad to see your names on my message board. I also realize there's a lot of people returning too, so I'm glad to see you keep getting value and that you come back for more of these. The way these webinars work, for those of you that are new, there's two ways you can participate. Number one, you can see the questions that people write and the responses that I give to those, okay? And during the live version of the webinar, I actually post the question on the screen. You can see it. But during the recorded version of the webinar, you'll have to listen to how I read them out loud. So I will be reading them out loud tonight too, so that people on the recorded version can hear them, okay? The second thing, the way that you can participate is on the bottom right-hand side of the screen is a chat box. And you can use that chat box to write shortish, a question to me. Keep in mind, this is a webinar, so I can't handle really long, complex issues and figure everything out in the course of your question and a brief response. So keep that in mind. This webinar works better for shorter questions, but if they're too long, I'll let you know and let you know I'm not going to be able to answer it, okay? So keep that in mind too. And then I am creating a recording of tonight's webinar. And I do this every week, and 99.99% of the time that recording works, but every now and then it doesn't. But if it works, I will be editing it up later tonight, and we'll wind up posting a summary of it, a synopsis of it, if you will, in an email, and let you know when the synopsis is ready, as well as when the recording is ready to be seen. That should come out tomorrow morning, somewhere between 9 and 9:30 a.m. in the morning at the latest. I usually get it out way before then, but I like to give myself a little breathing room on that. And then let's see, what else do I got? Oh, when I send out that email tomorrow morning, you'll be able to sign up for the next webinar. At this point, we're due to have one next week. However, I need to move that. So next week's webinar is not going to happen. It'll actually be in 2 weeks that we'll do a webinar. And it will be 2 weeks from today that we'll do the 3rd May webinar. Okay. All right. And so I think that takes care of all the business aspects of things here. Let's go ahead and get started. See what you have in store for me tonight. Hello, Gail. Let's see. Hi. I just did the Great Plains mycotoxins test with 1 week glutathione and hot bath before collecting. All normal, but aflatoxin is 7.69. Normal is less than 0.5. Ochratoxin is 12.31. Normal is less than 7.5. And zearalenone is 32.4. Normal is less than 3.2. Would all of these results indicate mold from exposure from a house, my house, or can they all be from eating foods that have mold? If so, won't all people have elevated levels of these molds? Can curcumin or quercetin be a supplement source of mold? Number 2, would it be prudent to test with RealTime Labs as well for comparison? And number 3, is there a binder that will get at all 3 at once? 4, at what point do I assume herbs aren't working to treat Bartonella? I have been on Montana Pharmacy Sita Akuta to 30 drops 2 times a day and Hutania 2 times a day. Let's see, it looks like the Hutania since late February or mid-February, and the Sita Akuta since January. Okay, so let me kind of take some of the, let's do the Bartonella treatment ones first. So whenever you're treating Bartonella, the germ Bartonella, whether you're using prescription antibiotics or herbal antibiotics, if they are working, you should start seeing some reduction, lowering of your Bartonella symptoms within about 2 months, maybe sometimes 3 months, but definitely by 3 months you should. So if you are not seeing some reduction in your Bartonella symptoms at this point, I would say that they're probably not working. And I think you said there's 0 changes that you're seeing. Okay. All right. So an alternative that I have been using, I haven't written too much about this. I know I mentioned in some of the webinars, you might entertain looking at the herbs cryptolepis and Japanese Knotweed. Okay. So cryptolepis is an herb we historically have used to kill babesia. But Johns Hopkins research came out about a year ago showing that it's quite effective against growing and persister Bartonella, as well as growing and persister Lyme. Okay, so we're going to actually treat all three germs, babesia, Bartonella, and Lyme. I would also then combine that with Japanese Knotweed, and Japanese Knotweed also has the same Hopkins research that shows that it's effective against, in the laboratory, it's effective against growing Bartonella and persisting Bartonella as well too, and can even do Lyme as well too. All right. So these days, when I see a treatment with Acidoacuta not getting far enough along, what I have been doing more recently is switching over to a combination of cryptolepis and Japanese Knotweed. All right. Now, the way that I dose that, if I'm using cryptolepis for babesia, I'm going to dose it in an adult at 1 teaspoon 3 times a day. If I'm using it for Bartonella or if I'm using it for Lyme, I'm going to dose it at a half teaspoon 3 times a day. Okay. And then the Japanese Knotweed, the dose I've been working with for Bartonella and even for Lyme would be work up to 30 drops 2 times a day. In terms of how you start these, so keep in mind, these herbs are good because they're going to treat growing and persister Bartonella. The cryptolepis can be kind of strong. It's strong tasting more than anything, okay? And so you might want to start that at a 1/4 teaspoon 3 times a day. See if you get some hercs from it, okay? If you don't, after about a week, you could go up to the half teaspoon 3 times a day. And then with the Japanese Knotweed, I'd probably start that at maybe 10 drops twice a day. Add a drop per day per dose, working up to 30 drops twice a day. Okay, so those are some ideas for you to think about. Okay, all right. Now, in terms of your mold toxin levels, these 3 toxins, you have the aflatoxin, ochratoxin, zearalenone. Even if you were getting this in through food, your body should break them down if you didn't have a toxin buildup problem. Okay, the fact though that you have these 3 would suggest to me that you probably have a building exposure issue rather than necessarily coming from food, okay? So I would wonder about this being from your house, probably some wet issues that your house has had and has developed some mold around that. Curcumin and quercetin I do not find to be things that are a source of mold or mold toxins. And then in terms of your question about RealTime. So what I find with the Great Plains mycotoxin test is I think it's probably good for gliotoxin. I think it can be good for ochratoxin. I do find, in my experience, I think that I get more better results with RealTime Labs, especially when it comes to picking up trichocethine, which is black mold toxin, and also picking up the ochratoxin as well. Okay, so and if I'm going to go for one test, I tend to go more for the RealTime test because I think it's more useful overall, more reliable. It picks up better the black mold toxins especially, and not do the Great Plains test. Now, I know that Neil Nathan, who's another doctor, as many of you know, that educates a lot about mold toxin illness, he advocates actually doing both. He thinks that between the 2 of them, you build up a better picture of what's going on with your mold toxins, okay? But I tend to rely more on the RealTime test, okay? And then is there a binder that will go after all 3 at once? For this kind of a picture of the 3, the aflatoxin, ochratoxin, zearalenone, what I like to do is use a binder product that has a variety of different agents in it to bind up those toxins in your intestine. So you might look at a GI detox by biobotanical research, or biocidin biobotanicals, excuse me. And then, or you might look at something called Mycopul, MYCOPUL, by Research Nutritionals, okay? And the various substances they have in their binder products can pick up this variety. And you might start at 1 pill a day, and after 7 days, if you're having a major worsening from pulling those toxins out, then you might go up to 2 pills 1 time a day. Sometimes I'll gradually work up to 2 pills twice a day. Now, With your binders, as many of you know, you've got to be careful with them because they'll bind up medicines and supplements too. So when somebody's using a binder to pull mold toxins out, what I'd like to advise them to do in terms of timing is to basically take them without medicines or supplements. Okay. And what that can look like is stop your medicines and supplements 30 minutes before you take your binder. And then you can resume your medicines and supplements 2 hours after you take your binder. You can actually eat any time in there, to be honest with you. Okay. That's what I tend to advise people. Okay. Now, for those of you that are listening in here and you're wondering, what am I talking about? So there's 25% of all people that when they get exposed to mold toxins from mold growing behind the walls or on top of the walls, they breathe in the toxins released by the mold, and about 25% of us can't remove them. All right. What happens in 75% of us is we breathe them in, our immune systems will tag those toxins, and other immune cells will then come down and break down those toxins that were tagged. Okay, that's what's supposed to happen. And so they never bother us then. Okay, I'm one of those guys. I go walk through a building full of toxin cloud and never have a problem because my immune system will break them down. What happens in 25% of people, though, is due to a genetic predisposition, the white blood cells do not correctly tag those toxins, and therefore other white blood cells do not come down and break those toxins down. The next line of defense that the body has for handling a fat-based toxin like a mold toxin is the liver is supposed to clean those out. The way the liver is supposed to clean those out is it's supposed to take these fat-based toxins through a bunch of chemical reactions, apply a water-soluble chemical group to the toxins, making them water soluble, and then they're supposed to move out into the intestines via the bile system and the gallbladder, and then they're supposed to mix in our poop. We're supposed to poop them out. That's what's supposed to happen. Okay. However, when you have a mold toxin problem, the liver can't handle those mold toxins either. So they go to the liver fat-based, they come out fat-based. And as a fat-based toxin, once they get moved out in the intestines, they get reabsorbed back into the bloodstream, and you just get this endless loop of toxins. Now, those toxins sitting in your bloodstream are directly hurtful to the various organs in the body, but in addition, they trigger inflammation from your white blood cells, a type of inflammatory chemicals called cytokines, which is the same situation what Lyme causes. Lyme causes excess cytokines. And the symptoms you get from Lyme and the symptoms you get from mold toxins, they look the same because all of those symptoms are due to excess cytokines, okay? So excess cytokines make it so you can't think, make you hurt all over, interfere with how your hormonal functions work, disturb your sleeping, give you fatigue, you name it. Those symptoms are excess cytokine symptoms. Mold and Lyme can both do that. Okay. All right. So anyhow, I wanted to bring that up. And then in terms of what Bartonella symptoms are, key Bartonella symptoms, everyone, that you can kind of look at and say, maybe I got Bartonella, is if you have a large number of these. And so the symptoms are pain on the soles of the feet, a lot of anxiety or depression or even hallucinations. So people with Bartonella often get psychiatric issues. Severe thinking. A decline in your thinking is much worse than the decline in your energy levels. Okay. So for instance, your brain function may only be operating at 20% of normal, and yet your energy is 50% of normal. Okay. So you've got a major decline, much worse thinking abilities relative when you compare it to what happened to your energy. Okay. Anything neurologic like tremor, shakes, having seizures or seizure-like disorders, sometimes that can be part of Bartonella. And then Bartonella can give you these rashes that look like scratch or stretch marks. Okay, so anyhow, those are what the Bartonella symptoms would be. Okay, I'm going to do a quick screen share here to show you all some resources you can take a look at. Okay, this is my Lyme education site, Treat Lyme by Marty Ross MD. I think most of you are familiar with it here. If you look over my online Lyme guide, and you hover over it, you get this big drop-down menu that divides things into different categories. Regarding an article I've written about mold detoxification or mold toxicity detoxification, look at the detoxification section here. And here's my article where I explain a lot more detail than what I just did, what mold toxin illness is. Okay. All right. And then in terms of Bartonella symptoms, take a look at my article over here called How to Diagnose, and this article about how to diagnose Bartonella. In that article, I review what kind of symptoms make us think about Bartonella. Okay. Keep in mind with Bartonella that you can have negative Bartonella testing and still have Bartonella. The testing is not perfect. Even IGeneX, who has come up with a newer way of looking for Bartonella, they're called a technique called their immunoblot. That immunoblot method may be about 90% effective at finding Bartonella if it's there, but it's not perfect. Okay, so you got to make decisions about whether to treat Bartonella and sometimes even whether to treat Babesia based on what your symptoms tell you. Okay. Anyhow, that's a lot of stuff I just said. Gail, thanks for your question and sparking me to go off in a bunch of different directions there. Good luck to you. Hello, Carter. Let's see. Which infection causes large bulging veins? A year after tick bite, I've now got some bulging veins in my calves. Have you seen this before? Yeah. So I have seen some of my patients develop bulging veins, and I think I tend to see it when Bartonella is present. Bartonella, one of the things it can do is it can break down some of the connective tissue, like collagen and things like that, that hold your blood vessels together, keep them formed into a small tube instead of a large swollen tube. So maybe that occurs sometimes in Bartonella. I haven't seen any science that proves that, but that's been what my observation has been. Okay. Thanks for that question. Hello, Ellen. Hello, Dr. Ross. All right. Hi, Dr. Ross. I guess I invented the hello part there, but I was successfully treated for Babesia 3 years ago, but since then have not been able to tolerate fruit, and I don't eat sweets at all. After some reading on your website, I've been doing the yeast protocol with my doctor's help, and I've improved a lot. Within a week, I will have finished the 30 days. Then I will eat fruit to see if it worked. If it wasn't sufficient, what should I do? Go back on nystatin alone, repeat the entire protocol, try a second resort protocol. On the other hand, if it does work, what is the best maintenance plan? Should I continue to take 4 human-based and 4 soil-based probiotics a day, or should I reduce that? I'm also using your Herbal protocol for persistent Lyme and Bartonella. Thank you. All right. Ellen, so it'd be interesting if I had the opportunity here to dialogue with you back and forth to try to figure out what you mean that you're doing better since being on my protocol. I assume what you're doing is one of the main ways that I recommend treating for yeast is to do a combination of nystatin and another prescription called diflucan. Diflucan is more of the bazooka. It's a stronger medicine, but because yeast can learn some resistance to diflucan, I usually like to include nystatin in there. Nystatin can sometimes limit the ability of your yeast to learn resistance, okay? In general, about 90% of the time that you use a diflucan nystatin combination for 30 days, yeast will resolve, okay? So the symptoms that make me wonder about yeast are increased sugar cravings, sugar intolerance, meaning you eat sugar and you feel a lot worse. Gassiness and bloating sometimes can be part of that. It looks like Mr. Thor has joined us this evening. That's my Basenji Thor over there. You can kind of see his ears. Anyhow, or down there on the floor is where he's been. Anyhow, so symptoms of yeast would be sugar cravings, sugar sensitivities. You get a lot worse when you have sugar. Gassiness and bloating, intestinal gassiness and bloating, that is. For women, it would be increased vaginal itching, sometimes vaginal discharges. And then another symptom would be sometimes a yeast in the intestines can release toxins that interact with your skin that can give you a greater amount of pimples or acne. and or could even give you a lot of eczema type rashes as well too. Okay, so you look at what your symptoms were before you started treating yeast, and if they were positive in any of those things I was just talking about, as you're nearing the end, you want to make sure that the sugar sensitivity is gone, that you're no longer craving sugars, that you're not having intestinal gasiness and bloating, and that your pimples and acne have gotten better. Okay, if they have not enough, then I will treat another 30 days with diflucan and nystatin. If it helped them, but they didn't get all the way there, I sometimes will treat a second time. It's very interesting if we look at using the same agents. Okay, so using the nystatin and the diflucan. If we look at studies about what is the length of time it takes to get rid of intestinal yeast overgrowth, there is no clear evidence saying what the ideal length of time is to treat. Okay. What I know from my practice is that in general, 90% of the time, 1 month is enough. But there are times I have to go longer based on what the symptoms are telling me. All right. Now, whenever you get done treating the yeast overgrowth and your yeast symptoms resolve, if it's 30 days or is it 60 days of diflucan and nystatin, at that point, I want people to keep a good set of probiotics going for at least another 6 months. And I usually will have them continue nystatin for another 6 months as well too. And the reason I do that, again, nystatin is a bit weaker than what the diflucan is, but it does a good job of policing the environment to keep any remaining yeast from popping back up while you continue to dump good bacteria into your intestines to help them repopulate. Okay. All right. Oh, there he is. That's Thor, everyone. I don't quite know why he's so active this afternoon, but he is. So we may see him doing some gymnastics back there. His sister Halo is sitting under the desk here. Halo's become a very old lady. She's 15 and a half years old now. Thor's 14 and a half, and he's got a little bit more vibrant still, although he's slowing down like Halo too. But I don't think we'll be graced by Halo this evening. Anyhow, so look at those symptoms, okay? But the key thing is, after you're done with your diflucan, you need to repopulate the intestines which is a good way of fighting back yeast that are there. So what I like to do, again, is use nystatin to keep any yeast from popping back up while we work with the probiotics to repopulate the intestines, okay? 6 months often is a good enough time on that, all right? Ellen, thanks for that question. Hello, Colleen. Hi, Dr. Ross. My blood work came back 209 for B12 and 35 dehydroxy or 35 vitamin D, 25 hydroxy. I've got B12 drops here that are 200 micrograms per drop, but haven't begun taking it yet. I'm almost never out in the sun, eat dairy free, and have been taking vitamin D3 2000 international units 1 pill for years. I was diagnosed with telogen effluvium by a dermatologist, and my hair was falling out a ton after a ridiculously stressful year. One of my Lyme friends told me I should be taking vitamin K along with the D3 and that my D levels should be higher. Even to the doc's office said it was fine. What do you suggest joining? Okay, so generally in chronic illnesses like Lyme, chronic fatigue syndrome, fibromyalgia, I like to keep my vitamin D3, which is also known as 25D hydroxy vitamin D, somewhere around 40 to 80. So you are just a little bit low, okay? You don't want to go much over 80 because then when you start hitting more like 100 level or so of vitamin D, that can lead to calcium deposits developing in your tendons and your ligaments and your muscles. But if you keep your vitamin D around 40 to 80, you get all the benefits without harm, okay? So vitamin D has got some evidence showing it's useful for immune function, brain function. It's good for bone health. It may be a super hormone that actually helps a lot of your other hormonal systems work well. So we usually shoot for 40 to 80, okay? Now, I find usually that that often that's going to require about 5,000 international units a day. And that's what I think you might want to consider doing, okay? In terms of your B12 level, that 209 is low. I agree with you. And what you might start doing with that, if you do the B12 drops, I would do those. You're probably going to get the best absorption by putting them under your tongue. And if you were to do about 1 drop a day, looking at where your B12 level is, I would bet within a month you're back into good ranges. Okay. The reason to do under your tongue is that you're going to get better absorption under your tongue. There's a small group of people that lack a protein in the stomach that's supposed to bind to B12 and get it absorbed through the stomach. And so to avoid any possible problem with that, you might just do it under the tongue. Under the tongue, the B12 gets absorbed directly into the bloodstream through the blood vessels under your tongue. Okay? All right. Good luck to you, Colleen. Let's see. Hi, Dr. Ross. I just want to wish you a happy birthday and all the best in the next chapter of your life. Thank you for these amazing webinars and for sharing the lives of Halo and Thor with us. Here's to one of the good guys on the plan. Thank you. I appreciate that. Yeah, my 61st birthday, everyone, is on Saturday. I was born May 13th. I'm a Mother's Day baby, actually. And I'm an identical twin. And at that time we were born on Mother's Day, my mom went to the hospital expecting one. She was large, but they were not, at that time, they didn't have the ultrasounds to be able to see what was inside. And they were only hearing one of our hearts, not both of our hearts. And I was the second one out. So I'm known as the gift in the family. At least that's what I try to tell my mom. She doesn't quite buy that. But yeah, so I was her Mother's Day present. And yeah, as many of you know, I'm closing down my clinical practice here. This is my last 2 days. Tomorrow, Thursday and Friday is my last day of clinical practice. And I'll be relocating permanently to Austin, Texas then. But don't worry, I'm still going to keep my Lyme education efforts going. That website's going to be updated regularly. I'm going to keep these free webinars going. And I'm going to be expanding. I'm actually going to be setting up a new online community for people living with Lyme. We developed a name for that called Lyme United Community Powering Health. Probably that's going to land. I think I'm going to wind up launching that around July. I would be ready to launch it in June, but I'm going to be traveling a little bit in June, and I want to be more available personally to help regulate things and manage things as we launch. So it's probably going to be July. And then down the road, I would like to set up a whole online support community for physicians and healthcare providers that are wanting to learn how to treat Lyme, but just need some support in doing that, and a community they can turn to get answers. And so I want to help start growing more doctors to manage this as well too. All right. And then I will keep my supplement store going as well too. So I'll be busy. It's just not going to be doing the clinical care anymore. Yeah. Thank you, Patsy. I appreciate that. Hi, Robert. Let's see. Hi, Dr. Ross. We know that too many cytokines being produced is responsible for many symptoms associated with Lyme, Bart, BABS, etc. Last week, you discussed how in the case of autoimmune disease, that disease causes antibody cells to mistake our own body parts as being invaders to be attacked. In cases with too many cytokines, are the cytokines indirect aggravators of basically the same autoimmune response, with the difference being one of dysregulation rather than autoimmune disease? Thank you for these educational webinars. I don't think they're directly the same. So, increased cytokines from being triggered by infection, being triggered by mold toxicity, leads to inflammation and can lead to a lot of the symptoms that we see in Lyme. Okay. But those cytokines don't attack your tissues. They don't attack you. Versus in an autoimmune illness, if a germ has parts on it that look like parts of us, amino acid sequences or protein parts, for instance, sometimes the antibodies that we make against them will happen to actually start attacking parts of us that look the same. Okay, so that's an attack which then leads to inflammation. But so the mechanism here are just a little bit different. Okay, all right. I hope that answered your question. Anyhow, thanks for your question, Robert. Hello, Albert. Hi, Dr. Ross. Can you recommend a source for cat's claw, otobobark, and cryptolepis in capsule or powder form? Also, one of the suspected mechanisms of long COVID in some people is the retriggered of dormant viruses like Epstein-Barr virus. My understanding is that Lyme can go dormant for a long time and then reappear if there's a dip in immune function. And I think I've heard you speculate that maybe COVID could retrigger Lyme in the same way it's hypothesized to retrigger Epstein-Barr virus. Might this also be possible with Bartonella? Have you seen or heard of this happening with Lyme or Bartonella? Okay. So first of all, Epstein-Barr virus is a virus infection. It's the monovirus that is common in healthy people. Okay. All right. And it occurs in people with Lyme and sometimes occurs in people with COVID as well, too. So there has been a theory in the world of fatiguing illnesses, whether it's Lyme, chronic fatigue syndrome, fibromyalgia, and now in long COVID, that one reason that people might get worse or have long COVID or have illness or a contributing factor of illness might be that their immune system is not as able, having had one of those situations, to keep the Epstein-Barr virus out of control, and therefore it gets out of control and you wind up getting cytokines from it and you get the illness perpetuates from that. Okay. The big problem, though, in that, it's a theory I've seen come up many times. I mean, it's even thought to possibly in Lyme, is that we don't have good tests to prove that people actually get elevated Epstein-Barr virus levels as part of their Lyme, as part of their COVID, or as part of their chronic fatigue. So there's a number of people that measure antibody levels and they against Epstein-Barr, and what they propose is that if a person's antibody levels become more elevated, that can be a sign that the virus is out of control. The immune system is not able to keep it under control anymore. Okay. But the trouble is they haven't been able to develop testing that proves what the viral load is, because you could also make an argument that the reason we're seeing increased antibody levels is that as a result of having Lyme or the result of having COVID, the immune system has become super hypervigilant and is even working harder to keep those germs under control. Maybe they're really under control. So I read with interest these theories about Epstein-Barr, even in Lyme and in COVID, as being part of the problem. And what I have to say is there's really no proof that that's so. That increased antibodies do not prove a virus has gotten out of control. Okay. So I just want to be clear about that. Okay. Now, I'm not saying that sometimes maybe it does happen. It's just we don't have good ways of knowing for sure. So what I like to do with the viruses in Lyme, for instance, is I don't test for my virus antibody levels at the beginning of a treatment. I might consider, if somebody has chronic active virus infections, if we're about a year into treatment and I'm not making big headway, then I might consider, if they have active virus infections, measure their antibodies. And if they're elevated, I might say, let's give it a try. Let's see if maybe you really do have elevated virus levels, and we're going to put you on antivirals like olive leaf extract, for instance, to get those germs under control. But I'm not going to do it right away. The other thing is, even if Lyme if Lyme specifically causes Epstein-Barr virus to get active from immune suppression, the treatment is get Lyme under control, because often then, once the immune system's working better, it'll take care of that Epstein-Barr virus by itself too. Okay. But yeah, I read with some interest. Maybe, there's a theory that Epstein-Barr virus might get more active in COVID, but none of the research has actually been done looking at virus levels, just antibody levels. And what I would say is that doesn't prove the virus is causing a problem. Okay. All right. And then in terms of could another infection retrigger any of the tick-borne infections if they still are in you and they're dormant or they're in remission? Yeah, it's possible. It's possible. Again, the issue with that too is with Lyme and Bartonella, we don't have germ load tests. We just have antibody level tests, and antibodies don't prove a germ is active. Okay. All right. All right. So thanks for that question, Albert. Let me show you an article that you can take a look at here. All right. So take a look at the infection treatment plan section here. Look at my article called When and How to Treat Chronic Virus Infections in Lyme, a Brief Guide, where I kind of review all of this again if you want to look at an article about that. Okay. All right. Thanks for your question, Albert. Good luck to you. Hello, Thomas. Let's see. Does Bartonella create its own toxin? And does Babesia have its own toxin? And does Lyme have its own toxin? Or do only some of them produce toxins? I can't find information on this. 7 known toxins to botulism at a molecular level, but can't seem to find much on what exactly Lyme toxins are. It just feels like deliberate censorship. So what I have to tell you, we think that Lyme has toxins. The science proving it is not there. I haven't seen anyone propose in the literature I've read about Babesia or Bartonella having toxins. Maybe they do, maybe they don't. I honestly don't know. All right. So there's just a shortage of literature, a shortage of science. I don't know that it's censorship, but rather that the science hasn't even been conducted because we underfund research on Lyme and tick-borne illnesses. All right. Thanks for your question, Thomas. Hello, Mosby. When you talk about toxins from these infections releasing through the skin, I know on days when I feel toxic, it's almost like my skin oil on my face has a low, mild, burning, acidic feeling, like a little bit of windburn. Have you seen this before in this line of toxins in the skin or fungal possibly? So let me just make some comments for everyone here. So the way that you get rid of fat-based toxins is either the liver is going to transform them into a water-soluble toxin, and then the liver again through the bile system and the gallbladder moves them out into the intestines, and in a water-soluble form you poop them out. Okay. But if the liver is overloaded, a backup method that you can get toxins out is by sweating. Now, if you happen to do infrared sauna, many of you may be familiar with the thing called infrared sauna, where you go in and you heat up, you purposely cause yourself to sweat. What the studies would suggest is about 80% of the detox that comes from that is not through the sweat. It's that the toxins get moved out of the tissues where they've been stored. They go through the blood to the liver, and the liver transforms a lot of those into water-soluble toxins. They mix in our poop, we poop them out. So when you heat up and you sweat, about 80% of the toxins that get moved and cleaned out are through the liver, actually. 20% or so will come out through your sweat. Okay? All right. Now, if the liver is just too congested with toxins that it's dealing with, then some more of those may come out in your sweat. And sometimes people start feeling like they have a bad smell, they have a foul odor. And yeah, maybe some of that is the burning kind of sensation you have on your face too. Okay. All right. Thanks for that question. Hello, Lynn. Let's see. Hi, Dr. Ross. When do you use grapefruit seed extract and in what dose? Does it target something for Lyme or Bart that isn't covered by cinnamon, clove, oregano, cryptolepis, Japanese knotweed, cat's claw, hutania, and sida acuta? Number two, recently a family member who had Lyme and Bartonella in the past has developed symptoms of headache, fever, nausea, diarrhea, and fatigue. After several years without symptoms, he's been off prescription antibiotics for over 2 years and off herbals for about 6 months. He also recently had COVID. Based on the questionnaire, it does not appear to be yeast. How would you differentiate if this is a new Lyme or Bartonella exposure? He has been out in nature in California, long COVID or Lyme Bartonella relapse. And what might be a thorough aggressive treatment? We prefer herbal, but we'll consider antibiotics if that is the wisest in this situation. Okay, let me look at the first part of this question first. Okay, so grapefruit seed extract is an herbal medicine that can treat the cyst form of Lyme. Okay, so let me just make sure we're on the same page with terminology here. So the Lyme germ has three appearances or three looks, all right? So you've seen pictures of this before. There's this corkscrew looking thing that's called a spirochete. And then some Lyme germs can move inside of cells. We call that the L form, or that's also known as intracellular Lyme. And then the third form is a microscopic cyst form of the germ, okay? So those are the appearances. In addition, Lyme has growth states. There are growing forms and there are hibernating growth state, okay? So the hibernators are something we call persisters, okay? So now science says that spirochetes can be growing or they can be persisting. Cyst can be growing or they can be persisters, okay? Intracellular, we don't know. No one's looked inside of a cell to say, can they go into hibernation or not? We assume they're probably growing though, okay? All right. So grapefruit seed extract, if I want to use something to treat growing cysts, I can use grapefruit seed extract. And I'm usually going to use that when I'm using a prescription antibiotic to treat the spirochete and intracellular Lyme. I will usually combine that with grapefruit seed extract to treat the growing cyst forms. Okay? All right. In addition, I'm usually going to, for persister Lyme, I'm usually going to combine a clarithromycin with grapefruit seed extract. I'm going to add something called liposomal cinnamon clove oregano to get at persister forms of the Lyme germ as well too. Okay, or persister growth state of the germ, I should say. All right. All right. Now, in this, if you're using though a cat's claw and a cat's claw for Lyme, the cat's claw has been shown to treat the cyst form of Lyme and spirochete form of Lyme and probably intracellular Lyme too. Okay, so there's no benefit in adding a grapefruit seed extract into these combination of herbs that you just mentioned here. Okay, all right. All right, then let me look at this family member again. Recently, a family member who had Lyme and Bartonella in the past has developed symptoms of headache, fever, nausea, diarrhea, and fatigue after several years without symptoms. He's been off prescription antibiotics for over 2 years and off herbals for about 6 months. Okay, so I hate to tell you this. I'm not going to have a good answer for you. You give me some history, but I would need to ask a lot more questions of that person to get an idea of what exactly his symptoms were when he had Lyme, what the original Bartonella symptoms were, what the original Babesia symptoms were, to help me get an understanding of how they compare with the current symptoms. And I would use that to help me determine whether I think this might be COVID, this might be Lyme or Bartonella at this time too. Okay. I can't do that in this kind of a format, unfortunately. And it's a hard thing to decide sometimes. And sometimes I just get a sense of it from talking with the person too. What I can tell you is that we don't have good testing that proves, is it Lyme, is it Bartonella, or is it Babesia? Because the testing we do for those is to remeasure antibodies. And the amount of antibodies may or may not correspond with the amount of germ load, or whether it's acute or chronic. There just isn't good testing. So it's more of a clinical sense that I have when I work with somebody trying to determine whether it is new, old, or COVID. It's just more of a clinical sense, unfortunately. All right. But to get that clinical sense, I would need to be involved in a visit with that person. Okay. Good luck to you, Lynn. Hello, Margaret. Let's see. What minerals and vitamins in your store do you recommend to people who are suffering hair loss because of long-term use of activated charcoal? Okay. So, everyone, activated charcoal is a binder that we can use to remove some mold toxins, okay? The problem with activated charcoal is it sometimes can remove minerals too. And that occasionally can lead to hair loss in people because their hair doesn't have enough minerals to grow correctly then, okay? So often what I'll do is I like using a product called Core Minerals by Research Nutritionals. And let me just pull that one up. We'll look at it together in terms of the dosing too. So I'm going to do a screen share here. All right. So this is my supplement store, everyone, Marty Ross MD supplements. As many of you know, anyone can order from here. If you're ever looking for an idea of what curcumin I recommend or glutathione I recommend, just search it up here and you'll see which products I carry, okay? And again, anyone can order from me. The advantages of ordering from me is that I try to curate for the best quality products that I know work because I've used them in my practice. So it takes the guesswork out of trying to figure out what's a good product and what isn't, okay? Number two, I cover any state or local taxes, so you don't have to pay those. And number three, I pay for free shipping as long as your order is over $50, okay? All right. The prices that I sell for here are the lowest that the manufacturers let me sell their products for. And so the way that I try to make it a little bit more affordable for you is covering those taxes and the shipping, okay? All right. So let me look at the Core Minerals product here. Okay, so this is the Core Minerals product by Research Nutritionals. And so they have a recommended serving size of 4 capsules here. And you can see the whole list here of various minerals and nutrients that you would get in this. And so 4 capsules, I would do 4 capsules one time a day. And that's usually what I do with my patients as well too. Okay, all right. Thanks for a question, Margaret. Hello, Doug. Hi, Dr. Ross. I've been diagnosed with Lyme, Bartonella, mold, and small fiber neuropathy. I'm about 6 weeks into treating mold and expect to start Lyme treatment in about a month. Questions. How long does it generally take to feel relief from mold toxicity when taking a binder? 2, should I wait to use BPC 157 for neuropathy until I'm further along mold, Lyme, and Bart treatment, or can I do it simultaneously? My neuropathy keeps getting worse, and I don't know that I can afford to wait months. 3, I've heard you speak in terms of Bartonella treatment taking 4 to 6 months to work. Do you mean it generally takes 4 to 6 months to put it in full remission? Dr. Horowitz recently posted his latest on dapsone and suggested that it can be very difficult to successfully treat Bart. Thank you for everything you do for the Lyme community. Your book is very helpful. You're welcome. Thank you. All right, let me go through these one at a time. So in terms of removing your mold toxins, I have seen one patient in particular that was just loaded with mold toxins that after 1 month of working 3 times a day with a binder, that she was 80% better. Okay. And in her situation, it wound up taking us about another 4 months to get them all out. Okay. She's been one of the fastest responders I've ever seen, and probably one of the sickest people with mold toxicity I've ever seen too. On the other hand, what I'm often seeing is it's going to be about 4 to 6 months of using binders, and people may not feel much difference at all. I go in to make sure we're even making headway in that situation. I will wind up repeat my, usually about 4 to 6 months, I want to repeat my urine mycotoxin studies to see, at least from a laboratory standpoint, are we reducing the amount of toxins in a person? Okay. So what I want to let you know, it all depends on the person. There's some people you might start seeing improvements within a couple of weeks up to a month. There's other people, it might be 6 months to a year before you start seeing major improvements from pulling all those mold toxins out. And so, which is a little bit different again than what we see with a Bartonella, for instance. Okay. All right. Now about Dr. Horowitz's comments. So Dr. Horowitz has a practice, as many of you know, that attracts a lot of people that probably have failed treatment elsewhere. So he has a selected group of people that are already in the difficult to treat camp. Okay. My comments about Bartonella, based on my experience of treating people that I haven't seen a lot of other people, but also have seen a lot of people, is that around 80-85% of the time, I think we can get rid of it in 4 to 6 months. There are 15% of people, in my experience, that Bartonella is a very complex, difficult to remove illness, but that's not everyone. And so we have to keep in mind that some of us have practices that skew a different level of difficulty. Now, I'm not saying I don't have a difficult practice. I have very difficult patients. But I think Dr. Horowitz, especially since he's done some of the research in the area, tends to attract maybe a different clientele, maybe people that have failed other doctors, and he has a larger group of those people, for instance. Okay. All right. And then let's see here. Number 2, okay, in terms of when I add in the BPC 157. So BPC 157, many of you know, is a peptide. And peptides are a group of chemicals we make. We make these naturally on our own. We think I've classified about 100 or more peptides that we make now. And each peptide has certain functions. So this one peptide that is made in the stomach lining is called BPC 157. And the reason the stomach makes it is to help with GI function and GI intestinal repair downstream. But it's been observed to repair damaged tissues, like injured nerves, injured muscles and tendons, for instance. It can help your cell energy factories called mitochondria work better. It can balance inflammation produced by what's called Th1 and Th2 inflammation, for instance. It can stabilize your mast cells if your mast cells are a little bit overactive as well too. So BPC 157, in terms of peptides, I call it the Swiss Army knife. It does a lot of things. Okay. The downside to BPC 157 is cost. It's expensive stuff. So you're talking $140 for a 1 month supply if you're using one pill twice a day. Okay. So I try to not use it as a frontline treatment because often we don't need to use it. If you can work to get the insult that's injuring your nerves under control, whether that's mold toxins or if that is a Lyme and Bartonella, those are the major things that are going to help your nerve function to get better. And you may never need to use a BPC 157, okay? So I reserve BPC 157 for those people that I've done a good job of getting their mold toxins out. I've done a good job of getting their Lyme or their Bartonella out. And even after 6 months, 9 months, their neuropathy is not getting better. In those situations, I might think about adding in a BPC 157, one pill twice a day. Okay. Now, if you wanted to do it sooner, fine, you could do that. The problem is that, again, we use it to repair damage. And if the thing that is insulting your nerves, like mold toxicity or Lyme or Bartonella, is not fixed, those nerves are going to keep getting injured, and you might just be throwing your money away because they keep getting injured. The injury is working faster than what the repair rate could be from the BPC 157, for instance. Okay. All right. But if you wanted to, you could. I think from a timing standpoint, it makes more sense to get the insults under control then add in your thing that's going to fix. Okay. The one thing you can do to limit some of the injury from the infections, the mold toxicity, though, while you're under treatment, is to do two things. Number one, work with the antioxidant called glutathione. Glutathione is a very strong antioxidant. It's made in every one of our cells. Its job is to repair injury. Sounds like a good thing. It can help with injury, okay? The problem when you've got neuropathy or injured nerves is in their quest to fix themselves, they may exhaust their glutathione gas tank, if you will, so you can fill it back up again. So what I like to do is fill it back up again. And so what I like using is a liposomal glutathione product. Liposomal means glutathione microscopically wrapped in fat. That increases the absorption. The product I like using is a product by research nutritionals called Trifortify. They've got good science showing that it does get increased absorption within the cells, okay? So it gets absorbed, and that's why they do the liposomal variety. For bad neuropathy, I might use it as a teaspoonful twice a day, okay? All right. The other thing you can do, even while the insult is there, would be to start rebuilding the membrane of the nerve. And that's to use a group of phospholipid fats found in a product called ATP 360. And that you would want to do 3 pills 1 time a day. Okay. Now, if glutathione and if ATP 360 is going to help your neuropathy, you'll know by about 2 months. If they are not, then I would stop them at that point. Okay. All right. That's kind of what my approach is. All right. All right. Number 3. So, so about Bartonella, 85% of the time in all people, not the sickest of the sick, but in all people that have fresh Bartonella and people that have chronic Bartonella, if you get on an effective treatment, if you find the things you take that start improving your symptoms, it is 4 to 6 months on average to get either eradicate or put the germ into remission. Okay. Yes, you can eradicate. I know some of my colleagues don't think you can. I think you can. Okay. All right. Thanks for that question, Doug. Where did that go? Oops. There we are. Okay. Hello, Dave. Let's see. What herbal supplement do you recommend to kill yeast, and how many pills do I take daily, with food or without? Can you drink alcohol, wine? How long does it take to work? Any interactions with other supplements, vitamins? Okay. So in terms of an herbal approach to treat intestinal yeast overgrowth, I like to use probiotics. Okay. So you got to put bacteria back in. The probiotic I tend to like using these days as my frontline probiotic would be to take a product by a research nutritionals called Multibiome. I would do 1 or 2 pills 1 time a day of that. That is made up of 2 varieties of probiotics. One is human type strains, the kind that normally live in our intestines. And the other general class that's in that Multibiome is something known as a spore forming or soil-based probiotic. And they tend to support the good bacteria that are in your intestines to work better. And they tend to support the human strain of probiotics that you're taking in that pill to gain a foothold and to stay there. Okay. All right. So definitely you want to do that. Okay. All right. Now, in terms, I just have to comment here, the herbal approach to killing, I'm going to give you the herbal killer here in a minute, is safe to take with alcohol and wine. However, alcohol and wine is a straight sugar source that's feeding your yeast. All right. So generally, I suggest when people have too many yeast growing in their intestines that they avoid simple sugars like cookie, candy, cake, ice cream, and limit alcohol intake. Okay. Because it's a food source. It's just feeding the stuff basically. Okay. All right. But what I like to use then as my killing agent is there's 2 different products I work with. One is a product called Capri Plus. It's CAPRI+, by a company called Karuna. And it's got 3 main ingredients in it. One of those is caprylic acid. It's got some garlic in it. and it has some oregano oil in it too, right? That's 2 pills 2 times a day, and that takes on average about 2 months and will work over the 2-month period of time. It's effective about 80-ish% of the time. Okay, all right. And then the other option would be a product made by Integrative Therapeutics called Phytostan. That's Phytostan. That also is 2 pills twice a day. And that's got in it some powder co, a little bit of caprylic acid as well, some rosemary and thyme oil, I believe, and something called indolenic acid is in it as well too. Okay, and that I give the same chance of helping as the caprylic acid, although I tend to have a feeling that the Capri Plus may be just a little bit stronger. Okay, but 2 pills twice a day, and you've got to give it at least 2 months, and that works about 80% of the time. Okay, all right. Let me just do a quick screen share here. I can show you these products. All right, so take a look. Hover over the supplements here. You can see my big drop-down menu here, and take a look at my yeast section down here. All right, here is the Phytostan product I was telling you about, and here is the Capri Plus product I was telling you about. And then in terms of the probiotic, this one called Multibiome over here. Okay. Thanks for your question, Dave. Good luck to you. Hello, Tim. When you talk about toxins from these infections releasing through the skin, I know on days when I feel toxic, I think I answered this one earlier. Yep. Hello, Mindy. Let's see. What is a non-toxic? You have checked the CoA and it is safe. Binder for Lyme and mold. I would like something I can take. What is a non-toxic? Non-toxic. Mindy, I'm not sure what you mean by you have checked the CoA and it is safe. I'm not sure what that means. So I can't answer the question. I'm not sure what you mean by that. Sorry about that. Hello, Doll. Let's see. I get these strange indented skin colored stretch marks that appear on my shoulders, across my collarbone, and lower neck. They'll often appear when I wake up in the morning and then disappear later. They're not indentations from lying on the bed sheets or shirt. Do you think that's Bart or Lyme? I have seen that kind of thing happen in some of my Bart patients, although typical Bartonella scratch and stretch marks, rashes that we see, are the kind that don't come and go. They just stay, okay? But I have seen something like this occur in some of my Bartonella patients before, okay? Thanks for our question. Hello, Heather. Let's see. One of my most prevalent Lyme symptoms has been a constant chronic gastritis with mast cell issues that is now slowly improving with treatment. I have a central line and a gastric J tube, and I am on 200 milligrams BID of IV doxycycline, 600 milligrams BID of IV Teflaro 4 days out of 7. I want to try to add in some herbals that I purchased from your website, including knotweed, cat's claw, endographis, skullcap, and biocidin, all liquid tinctures, as well as capsules that contain cinnamon clove, oregano oil. Which of those do you think are least likely to cause upset stomach? And can I put any of these through my tube despite the alcohol? Are there one or two in particular that I should start with? Also, if you are pulsing IV antibiotics 4 days on, 3 days off, should you still use a biofilm buster on the 3 off days? Thank you so much, Radu. So, in terms of biofilm, so biofilms, everyone, are sugar cyme layers that can cover Lyme, Bartonella too. I'm not so sure about Babesia, but Bartonella, it can. And, breaking those down at all the time, you don't need to pulse those. Okay. I would, in my practice, I would leave somebody on those even on the non-pulse days. Okay. All right. And then in terms of alcohol in your tube, you might want to talk with your doctor that put the tube in and just make sure you can put alcohol down that tube. In other words, from what the tube is made out of standpoint. But in general, tubes should be able to handle alcohol. And the tinctures are all alcohol-based, basically. Okay, so that's why you might just want to run that by. I want to put some alcohol down there that comes in some of my medicines and see what they have to say to that. But I don't see why there would be a contraindication to that. But check it out. You make sure about that, okay? And then let's see. So here's what your problem is going to be. These, the cat's claw, the knotweed, andrographis, skullcap, and even the biocide are all alcohol-based tinctures, as I just said. And the problem with that is that alcohol can be very irritating if you've got gastritis going on, okay? A way around it you could try is to take the amount of the herb, like if you're going to be doing cat's claw 5 drops 2 times a day, we can do is boil some water and drop, literally use the eyedropper and put the drops into the water, your 5 drops into like 1 ounce of boiled water, for instance, and let it sit for maybe a minute or so. And what will happen is a lot of the alcohol will steam off, but not all of it. That's the problem. But if you can steam off some of that alcohol, you might be able to have your stomach tolerate that. Okay, you might. All right. The cinnamon, clove, oregano is very irritating it's caustic. It's very irritating to the lining of the stomach. And if you've got a lot of gastritis going on, I don't think there's a way you're going to be able to fix that to be able to take it, basically. In terms of what you are on, it's hard for me to say without knowing more about you. I can't say what order to add these in. I need to know a little bit more about what your symptoms are, okay? But I do want to let you know that, yeah, you could steam off the alcohol and try and see if that will be tolerable. I doubt that you're going to be able to tolerate that cinnamon, clove, oregano. Okay, all right. Good luck to you, Heather. Hello, Susan. What do you recommend for failing kidney function? Doctors just want to do Lasix, which seems to make a lot of people worse. So there isn't, unfortunately, with liver, we got herbs that we can use to support liver. I am not aware of any herbal options that support kidney function, unfortunately. So I don't have a good recommendation for you on that one. Sorry about that. Hello, Anna. Anna says hi. Hi back, Anna. Thank you for writing that. Hello, Frank. Let's see. Hi, Dr. Ross. Thank you for all you do for us. You're welcome. Let's see. I have been diagnosed with Addison's, hypothyroidism, and Bartonella. I tried fluconazole with half doses of doxy and azithromycin. My liver could not tolerate as I experienced elevated liver enzymes. Could switching to quarter doses of doxy and azithromycin help? Thank you. Wow. So I'm sorry. Wow I'm sorry to hear that you had elevated liver enzymes. In terms of what likely would be causing that here, of the 3 things, the fluconazole, doxy, and azithromycin, it's probably the fluconazole that has a greater chance of leading to liver inflammation. Okay. Rarely azithromycin, but doxycycline should not lead to that. And so, so I don't think that switching the doxine azithromycin is the issue. The issue is the fluconazole. What you could try to do is do half dose on the fluconazole. So instead of 200 milligrams a day, try 100 milligrams a day. But in the month and the week, not month, a week or so leading up to beginning it, I would work with, start taking some glutathione. Glutathione can help limit liver inflammation, supports liver function, and helps with detox, okay? And often it can help remove that liver inflammation that fluconazole might be causing, okay? So what you might do is a teaspoon twice a day of Trifortify by Research Nutritionals. Go at that for about a week, and then try the fluconazole at half dose and see how well you tolerate that. Okay, that's what I would do with my patient, all right? Obviously, it's something you should talk with your own provider about, though, too, okay? All right. Good luck to you, Frank. Oh, and then when you're on the fluconazole, stay on the glutathione. Keep taking it, okay? Hello, Joanne. Hi. In 2020, I had a blood test that showed 2 IgM bands for Lyme, 23 and 41. It finally went IgG 6 months later. Now, 3 years later, I had a relapse, and my IgM 23 band is positive again. IgG is band 18. This was the Western blot. Should I be concerned about the one IgM positive 23 band recurring? Thanks. Love your podcast. Appreciate you helping all of us with Lyme. Yeah, you're welcome. Thanks, John. So this, and I may not have a straightforward answer for you, but let me describe some things. Okay. So, all of you may know, whenever you first get an infection, the first family of antibodies you develop are IgM. Okay. So IgM antibodies are what we consider to be the acute antibody response that people get to infections. And usually in most infections, by 6 weeks to 3 months, those IgMs will go away and they get replaced by IgG. Now, once you make IgG antibodies, they will remain, and they're the memory of the immune system, okay? And so just keep that in mind. When you get IgGs that are positive, there's no way of knowing from looking at an IgG level whether it's a response to an old infection or whether there is a current ongoing infection. The best we can say with IgGs is there's evidence you had a germ in you. And because of the memory of the immune system, we can't tell by looking at it whether it's gone or still in there. Okay. Hold on here a minute, everyone. I'm sorry. Swallowed down the wrong hatch there. All right. Now, in Lyme, about 50% of the time that somebody has Lyme and they had acute Lyme let me rephrase that. About 50% of the time that people have chronic Lyme, their IgM still remain positive, even though they're not supposed to. We don't know why for sure. There's some theories as to that happening, but it is a phenomenon that happens, okay? And how we know about that is about 20 years ago, the NIH funded a number of research projects trying to answer the question, would there be any evidence that long-term antibiotics would work to treat chronic Lyme? And they did four studies that they funded. But in screening for people to participate, these had to be people that had failed treatment already, and they had to test, and they had been through treatment. So they had acute Lyme, they'd been through treatment, and to get in the study, people had to be tested and shown to have antibodies consistent with having Lyme. In their screening, they found that 50% were still making IgMs. All right, why that is, we don't know. Okay, so to your question here, The IgM23 could be either due to a new infection or because sometimes they don't completely go away, or they may be there at levels you can barely detect, but then you get a reactivation, they go back up again. It could be part of an old infection. I can't tell from looking at it whether it's new or old, basically, okay? Let's see what your question was here. Yeah, that relapse may be just due to a reactivation of your old Lyme, not necessarily an acute infection, causing your IgM23 to be up. Okay. All right. Good luck to you, Joanne. Hello, Mindy. Let's see, in the middle of the night, that doesn't require a full glass of water, as I'm concerned about binding my nutrients. So I'd really like a good binder to take for mold and Lyme in the middle of the night. A binder where you have seen the CoA and it doesn't have tox. I don't know what you mean by CoA here, unfortunately. So I can't answer that part of your question there. Let's see. I think I have Babesia per my Vibrant America, but would like a better test. What test should I do to verify my Lyme disease? The Quest is negative, but the Vibrant America is positive for a couple of Babesias. Thank you for your help. Also, how do you verify mast cell activation syndrome? Do you recommend root canal removal for Lyme patients who struggle after root canal with bizarre symptoms? Okay, so Vibrant America offers a number of tick-borne tests. Of the tick-borne infection tests that they offer, they have only done adequate validation on their method to see if Lyme is present, okay? So their Lyme tests, I think, based on their published studies about looking at people with and without Lyme and figure out how accurate their test is finding it, I think their Lyme germ, the Borrelia test, is accurate, okay? Their Bartonella and their Babesia and their Anaplasma and their Ehrlichia testing, they have not validated adequately. I can't tell whether they're right or wrong. They haven't gone through the steps to look at whether their test is accurate at picking up what they say it picks up, okay? In my opinion, your best test these days for Babesia and Bartonella is to do a method that is offered by IGeneX, which is called an immunoblot. The immunoblot is a method that they've developed to look to see if your body is making antibodies against proteins found on each of those germs. Their studies, I believe, show about a 90% success rate at picking up those infections if they are there. The advantage also of doing IGeneX is they test for specific strains. Like on the Bartonella, they will test against 4 specific kinds of Bartonella and against the family. And for Bartonella, for instance, we think there are 15 strains of Bartonella that can infect people. And there, with the IGeneX test, if you test positive against the family, but your 4 specific strains are negative, then it means you got one of the other 11, you still should treat, okay? So their test, compared to other labs out there, they have the ability to test for all 15 varieties in a sense, all right? Same with Babesia. Babesia, we think there may be 15 to 20 strains. Most labs can detect maybe 1 or 2 strains, but because IGeneX is looking to see if antibodies against the whole family of germs that might infect you with that are Babesia, they can detect the strains that other labs can't pick up. All right. So I would recommend, that's where I would go with that. Okay. Let's see. How do you verify mast cell activation syndrome? So mast cell activation syndrome is usually more of a clinical diagnosis of whether you're having a lot of symptoms that we see with ongoing release of histamines from your mast cells. Okay. There is some testing you can do, and it's best to do that testing when you have a lot of your mast cell activation symptoms. These would be things like measuring histamine levels in your blood, okay? Something called PGD2, I believe. I'll show you the article here in a minute. But the problem is most of that testing is not accurate. You just got to go by mainly what the symptoms tell you, okay? And then let's see. In terms of root canals, the problem with root canals is that when a root canal is done, it sometimes leaves a pocket at the bottom of the tooth that can become infected with Lyme germs, all right? So if I've got somebody that I've treated for their Lyme 6 months, 9 months, a year, we're not getting any headway, and I know they've had a lot of dental work and possibly root canals, I'm going to ask them to go back to their dentist and figure out whether there might be some hidden infection within the roots of those teeth, okay? So that's when I'll wind up doing that, okay? Thanks for our question, Mindy. Hello, Erica. Hi, Dr. Ross. Thank you so much for all you do for us Lyme patients. You're welcome. I was wondering if you could talk a bit about how sedation affects Lyme patients. I got a lot worse after having more than 14 ECT sessions, and I'm thinking it might be from reactivating Lyme disease. Many thanks for your insights. Huh. All right, so in terms of sedation, I want to describe what sedation could be. Okay, so there is what is known as general anesthesia sedation, and that type of sedation is they put a breathing tube down your throat and they use anesthetic gas through your lungs. Okay. Another type of sedation is to do, some people call it conscious sedation, some people call it IV sedation. It's where you have medicines given to you through your vein that are in the Valium and similar families that basically make you really sleepy and you just ignore everything going on. Okay. General anesthesia sedation, the observation I have and most of my colleagues have is that when our patients get general anesthesia, and we don't know why, that their Lyme tends to get more active. That tends not to be as much of an issue when people are already on antibiotics, but if they're off antibiotics and the Lyme is still in them, we sometimes see they get worse. Okay. We don't know why that happens though. Okay. IV sedation, on the other hand, I have not observed it to lead to any activation of Lyme or other infections. I'm not aware about whether ECT can or not. I haven't had to confront that with my patients as to whether it would lead to some activation. So ECT, I believe you're meaning electroconvulsive therapy, okay, electric treatments to the head that we do for people with severe depression. I haven't seen that activate anything, but I haven't seen many people get it in my practice either. Okay. All right. Good luck to you, Erica. Thanks for your question. Hello, Pat. Hi, Dr. Ross. I read that Lyme patients who develop candida will be susceptible the rest of their lives and will need to eat sugar and bread-free the rest of their lives. Is this true? I don't think that's true. I have a lot of patients in my practice that either had too many yeast growing in their intestines when they first came to see me, before they ever got treated for Lyme, or as part of treating Lyme, they got yeast. And it is true that once we're done and off the antibiotics, either herbal or prescription, you are at an increased risk of getting yeast. But most people over time get to a point where they're not getting yeast again. Okay. All right. My program at the end of treatment, when I'm pulling somebody off antibiotics, is I like to leave them on probiotics for a good year afterwards to repopulate the intestines. I often will also leave them on nystatin, which is a prescription, or the herbs Capri Plus and Phytostan that I discussed earlier. And I would do the herbs at 2 pills twice a day or a nystatin at 2 pills twice a day. And I would do those for a good 6 months after we stop herbal or prescription antibiotics too. Okay. So do the killers for at least, mild killers for at least 6 months and stay on good probiotics for a year. And what I would say is my experience says probably 90% of people, I never see them again, nor do I think they going to get yeast again. Okay. So it all depends on what you do at the end to try to prevent the problem from happening. Okay. All right. Thanks for the question, Pat. Hello, Denise. Let's see, Dr. Ross, feeling so grateful we have you. Thank you. After 18 months treating for Lyme, Bart, tick-borne relapsing fever, reactivated viruses, and not making tremendous progress, my doctor mentioned recently that my genetics test had shown a low positive Babesia, 21, I think. I had been unaware of this. Is this significant enough to treat for Babesia? It's a good question. So the problem with tick-borne illnesses is it's not always apparent what is there at the beginning of treatment. And sometimes as you treat, either the symptoms of one of the underlying infections will start standing out more. I call that peeling the layers of an onion. As you start killing off Lyme, sometimes the symptoms related to a Lyme to a Bartonella or Babesia, for instance, become more obvious to you. Okay. But also, all of us, whenever we treat for tick-borne infections, are constantly trying to figure out, is there a co-infection I'm missing that was not obvious to me at the beginning? Okay. And so the odds that you've missed a co-infection increase the longer you treat and no one's getting better. You have to start thinking, I have to start thinking, there's got to be something here I'm missing. It's just not obvious to me. They don't have the obvious symptoms, or the testing wasn't fully there. Okay. Now, Babesia is one of those, especially if you've got ongoing fatigue. Babesia is notorious for giving severe fatigue. And so at the beginning, if you just had a low positive Babesia without much symptoms, I wouldn't treat it. I'd probably think that's probably not there. But again, as we progress and we start wondering, why aren't you getting better? You have to start putting everything on the table again. And with that Babesia, low positive, it might mean something if you're not getting better. Okay. So that's how I approach those kind of things too. I would say it's possible. Okay. All right. Thanks for that question. Oh, one thing I should say too. So if we look at co-infections, the East Coast is where I've seen the best studies on this. But if we look at like in the New England states, Connecticut, and that area, some of the studies suggest that at least 70% of the time that a tick carries Lyme, it will carry one additional infection. And at least 50 to 60% of the time, it will carry at least two other infections. So in people I treat from the New England states, I'm always wondering, is it more than Lyme? Is it also Bartonella Babesia? Or is there an anaplasma or Ehrlichia in there? Okay. Because that's what the science tells us. Okay. All right. Hello, Christina. See, I've been told that oil oregano kills good bacteria. Is this true? Personally, I have had very good results with oil oregano. I haven't seen it kill good bacteria. I haven't seen, for instance, I will use it if I think I've got people that have dysbiosis, meaning an overgrowth of unhealthy bacteria in their gut. I'll use this. And it also treats yeast. And I've never seen people go on to get too many yeast, for instance. So I use it to treat dysregulated bacteria in the gut. All right. Hello, Anna. Let's see. Hi, Dr. Ross. I was on a pulsed antibiotic for 9 months with little improvement and stopped because I was getting weak. I started herbs, and noticed some improvement. What are your thoughts on bicillin shots? I have Lyme, Babesia, and Bartonella. Thank you for your help. All right. So bicillin is a type of penicillin. The penicillins, whether it's amoxicillin, augmentin, or bicillin, are useful at treating only the spirochete form of the Lyme. They do not treat intracellular. They probably don't treat cyst form of Lyme, probably just the spirochete, nor do they go after hibernators as well too. Okay. However, in some people, it can make a big difference. the reason you would do a bicillin is it's you inject it into your butt muscle. You do it 3 times a week, and it leads a deposit in the butt muscle that slowly feeds into the bloodstream, so you keep kind of a good steady level of your bicillin. It is an equivalent treatment to an intravenous antibiotic in that way, okay? And when we look at oral versus IV antibiotics, I find orals are helpful about 90% of the time. IV antibiotics and IV equivalent antibiotics like bicillin injections can be helpful 95% of the time. So if you're not getting anywhere on your orals, it is reasonable to think about looking at injectables too, okay? All right, thanks for the question, Donna. All right, guys, I think that's it for me for tonight. I've enjoyed being with you here. Again, I'm going to wind up canceling next Wednesday because I'm actually going to be on the road driving from here back down to Austin, Texas. Actually, driving from here down to see Dad, 91-year-old Dad in Colorado Springs. And then from Colorado Springs, I'll eventually be making it back down to Austin. So I won't be able to be with you next Wednesday. I will add another webinar on in 2 Wednesdays, though. So tomorrow's email, you'll see a link that you can use to sign up for 2 Wednesdays from now. Okay. All right. And then let's see. And then look tomorrow morning, sometime in the morning, you'll get an email from me, and I will have it done at the latest by 9 to 9:30 a.m. Pacific Standard Time. That email will include a synopsis of what we talked about tonight, as well as tell you that the video is ready to be watched. Okay, so take a look at that. The thing I ask you, if you find benefit from these webinars, other people will too. I'd appreciate if you share my emails with people you know would benefit from hearing about this stuff or learning from the topics we talked about, or even being part of next webinar in 2 weeks. Okay, I'd appreciate if you'd help me reach as many people as possible. Good night, everyone. Oh, and the reason I'm stopping right now is I'm going out for an early birthday celebration with some of my good friends. So we're starting to celebrate that day already. All right. Good night, everyone.